So last time we talked about market segmentation and positioning and targeting. So can you remind me and refresh my memory? حدا بيقدر يحكي لي الفرق بين segmentation and targeting؟ حكينا عن موضوع كثير مهم which is how to choose which customer you need to serve and why we need to serve the whole population or the whole target customers. Why don't we focus on a small segment? Then within this small segment, sometimes we decide to serve even smaller segment or niche سميناها, right? So حدا can you give me more thoughts about segmentation and target, or at least how we can really decide which segment we need to serve, or whether it's always good to do segmentation? Well, it's better to serve the whole market, giving one product that like one size fits all rule. So حدا عنده أي thoughts in this regard؟ حكينا احنا عن market segmentation وهو parts of a market. يعني في عنا market كبير, huge market where the exchange is going on. حكينا عن market segmentation وهو part of this market segment of this market. والtargeting, حدا بيقدر يعرف لي targeting؟ حكينا هي segments that you need to serve, that you need to enter. حكينا الأشياء that make you decide how to serve those customers inside this target. حكينا فيها you have different strategies. Either you do product differentiation or market positioning. The product differentiation, حكينا how or what makes your products and services really different than others, especially those competitors. And in market positioning, you know how consumers perceive the product. Okay? Safe. عم بيتحركوا السلايدز؟ طيب بدي ارجع على المقدمة مرة ثانية. حكينا in general market segmentation involves dividing the market into small segments that reflects their needs and wants actually. وركزنا على different way of segmenting. حدا بيقدر يذكرني إيش how we can segment the big market into small segments or small parts that I can really target? What about the demographic segments, geographic segments, income segments, behavioral segments? So do you have any question regarding all these segments? We segment sometimes based on gender and age. I mean, demographics, based on the location, the climate, where the customers live, how far you are. Income, so you can do kind of income. Okay. The whole topic is all about the importance of market segmentation. اللي احنا اتفقنا what's the market and what we mean by the segment. Now, why we need to do all these hassles and all this research and all these observation to the market and divide it based on different variables like income, like age, gender, behavioral attitudes. So there is kind of benefit out of segmentation معناته. So why we segment? Why it's important to do segmentation then before deciding which segment to serve? أكيد لما أنت تحدد the market and the different segments and which segment that really meet your desire to serve, that will create kind of focus. You focus your resources on a small part, so you better be able to serve this small segment of people. You will be much able to understand their needs and wants. مظبوط? Right? And this might allow your business to grow up and you can increase your share. إذا بتتذكروا حكينا last time عن market share. So imagine the market is growing, okay, regarding a particular product, and you're only focusing on a small segment, and you are increasing the delivery, and you are increasing in the product differentiation and the proposition of value. So this would lead you to dominate on the market, having some market share. So this will lead you to a star, okay, a very good source for profits. So also market segmentation will help with the new product development focused on needs of customers in the segment. It's always about their needs and their wants and their demands and what the customers are looking for. Back in the days, one product in the market supposed to serve all the desires and all the needs and wants. But this is kind of an old-fashioned marketing strategy. Now we have to deliver variety of product, even for the same product. We find different sizes, different doses, different pharmaceutical shapes, okay? in order to meet the demands of the consumers. Why we always trying to meet the demands? If you look at this chart, this is actually a very important chart, and you might tell after this where you find yourself. Are you innovators? Are you early adapters? Are you early majority? Are you late majority? Or you are laggers? حد بيقدر يخبرني what this all about لما نحكي عن innovators at one end and laggers at the opposite end. حدا بيحكي, I'm gonna give you just like a simple example. As some of you, يا شباب, they like innovations. Like a new phone came to the market, they go and buy it, like next day, or maybe the same day. A new game came to the market, they go and buy it. A new pharmaceutical or OTC came to the market, like kind of beautiful combination or amazing combination, they go and buy it. A new tool in the market, a new software, they go and buy it like the same day or maybe next day. Those are innovators. And those people, they take risks. They only care about having what they really like. Innovators. Hella, after the innovators, there are like kind of small group, some early adapters. They are first to adapt, but they wait a little bit ليشوفوا innovators whether they like it or not. The early adapters playing a good role to influence the early majority. early يعني معظم الناس بالايرلي majority والlate majority يعني تقريبا يعني the majority of people lie here, okay? So they wait for the early adapters to influence them. عشان احنا هيك احيانا بنشوف بالدعايات, بنشوف بالبروموشنال campaign, they're bringing like ناس معروفين, right? Famous people to influence others. So once the early majority get influenced by the early adopters and they're gonna feel more comfortable to buy the product, then they will be followed directly by the late majority who gonna wait a lot of time to see other people trying to buy the product and trying to use it and see the benefit out of it. So this is going to take time, like maybe after you have the product in the market, like in a few months or maybe years, those people will have it eventually. Now laggards, people who resist change, like they don't use smartphone, they're very convinced they don't want a smartphone. There is no need for a smartphone. They don't use cars. They really believe that they do need to use the cars. They don't use kind of vitamins because they don't believe they have to use vitamins. So those people are very hard to convince, but eventually several factors would play a good role to influence those people. Maybe the price will drop, maybe everyone praising the product and saying this is a high quality product with the low price of the value increase. So at the end, those late adapters will might actually get the product. So هذا الإشي عايش بيحتمل. Like do you think we just draw this kind of curve and we divided it just like that? No. هذا الإشي بيحتمل على النولج تاع consumers. Okay, you always need to consider that your consumers, they know what they're looking for. They have some kind of information and they have attitudes. That's why we say attitude is very important. So if the consumer تاعك عنده knowledge عالي وعنده attitude عالية, so what else they're gonna do? They're gonna adopt, or they're gonna buy, or they're gonna accept the product or the one they are looking for. So هذا المنحنى بيعتمد على knowledge. That's why we always have like promotional campaign, we have ads, and we have different relationship consumers. هلا رح نحكي عن بعض أنواع consumers that they really either innovators أو بيكونوا adapters. So every segment here have different characteristics than the one before. Okay. So بناء على هذا الحكي, once we talk about the benefit, so you might find quality buyers. بعد ما تعمل انت segmentation وتحكي I'm gonna target this particular segment, يمكن مثلا الناس عندهم chronic diseases او الناس عندهم chronic diseases only more than 70-year-old. عرفت كيف؟ فانت once you narrow it down, there is a benefit out of it. يمكن انت تصير قادر انك تحدد who are those consumers or customers you are trying to serve. راح تلاقي you have price buyers, there's relationship buyers, value buyers, and then there are different economy buyers, then different consumers in each segment. Before, we serve the whole market. We don't know what exactly they are looking for, or what their taste is, or what kind of differentiation and characteristics of the product those consumers looking for. Now, after segmentation, we can tell that, for example, we have price buyers. هذول الناس بيكونوا they want to buy product and services only at the lowest possible price. Or you can يكون a relationship. They want to have a good relationship with the supplier, okay, or with the pharmacist, okay, and because they expect هذا الpharmacist or suppliers or the one who provide the services to take care of them. يكون value buyers. These أو هذول consumers actually they understand the value. حكينا الvalue عبارة عن a trade-off between the benefit and the price. So هذول value buyers بيكونوا قادرين إنه to get or to know how to get the most valuable or the most value خليني أحكي من the product at like they're gonna be kind of indifferent about the price because they only focus about the value. High benefit and might be for some consumers like the price is not that sensitive or is not that high. So only value buyers. So once you start to know, like you have value buyers, you have equality buyers who are looking always for high quality. You have economy buyers, they need to get the lowest possible price. You have service buyers, they need a good relationship. You want them to take care. So you start to differentiate your services. You start to provide different pharmacists at the first stage with several skills, communication skills. You start to train your pharmacists the way to present what they have, the different services, different products. أحيانا تدخل على مكان قهوة، okay؟ تسأله أي سؤال بخطر على بالك بيجاوبك on the spot because they're well trained, they're high educated people. هلا قبل ما أحكي عن البنفيت of segmentation, you can, like you name it, several benefits can come out of this segmentation. بدي أسألكم سؤال. Do you think segmentation always gonna get you positive and fruitful benefit؟ هل هو دائما عملية السيجمنتيشن عن جد would help us to understand consumers? This is a good thing, but would help us to develop our products and differentiate and positioning. Yes, this is also a good thing. Segmentation would help us to grow, yes, and increase our market share, yes. But do you think this is always correct, or do you think there's any drawbacks for the market segmentation? Is there any risk of market segmentation, or there is any kind of disadvantages for the market segmentation? Of course, when you think about the market as it's not kind of constant market, you're always dealing with dynamic market, okay, fast changing market. Okay, people they change their attitudes regarding the products. They start changing their attitude regarding the medication they want. They might start doing maybe follow healthy lifestyle and give up medications. So it's dynamic, changing. So you cannot expect what's going to happen next year, okay, in terms of consumers' needs and wants. وأيضا because you can really identify small segment وتعرف the needs and wants تاعهم، هذا لا يعني and you can reach them. Okay, you must really divide the whole market to small segment. and تحكي هاي segment are those like people with who really need insulin, or first type diabetes, or people with multi-comorbidity, but maybe you cannot reach those patients, so you can better serve them. So this is another problem. Also, segmentation is an imprecise، خلينا نحكي science data, not always available and up to date. ليش؟ إنه إحنا how we do segmentations sometimes based on observation, sometimes based on the data that you have in the system, and most of these data بتكون demographics حسب الage، حسب العمر، حسب الانكم. أحيانا هالعملية ما بتكون up to date أو ما بتكون very precise that بتحكي أوكي أنا عندي 5 segments. هاي 5 segments يمكن يكونوا not really reflecting different segments of the market based on whether these variables that you really based on in the first place to make this division كانوا accurate ولا لا. يمكن الديموغرافيكس أسهل شيء لأنه دائما موجود عندك على السيستم، but imagine you are segmenting the market based on their attitudes. Okay, so this might lead to a challenging part of the segmentation. So what if I told you now after you do all this segmentation, and since you are a pharmacist or clinical pharmacist, so you're going to have a deeper look into the consumer's needs and wants. This, like in terms of healthcare services, you will find out, like after doing the segmentation and try to divide the market, or let me say the patient market, into different segments, you will find that you have like several small segments that you must really best or be able to meet their needs and demands. We have something called hypochondriac. In medical science, these terms reflect an anxiety, like health and anxiety. Like people or studies showed that people with high anxiety, they're gonna go and seek health, right? And they seek medical services and they need medications, and they always concerned that they have kind of diseases, or so they're always anxious about their own health. They need health. So this is a type of people that you're gonna meet in your market or in your business. Or you're gonna meet consumers after you do the segmentations who really health seeker. Okay, they're always looking to improve their life. Okay, they're always taking care of themselves. They're not anxious or worried, but they're always trying to improve the lifestyle or take preventative kind of care to avoid diseases. So thus maybe they're buying vitamins, they're doing exercise, they're involving in smoking cessation programs in your pharmacy. Okay. You're gonna meet band aider. هذول الناس they are actually hesitant to go and find more about their health. They always brag how healthy they are, and they believe that they don't need any kind of health services. Someone being aided. Okay. أحيانا you're gonna find don't bug me category of consumers who always follow negative health behavior. The smoker, they don't do exercise, they don't eat healthy, they don't follow like physician advices, okay, they don't follow pharmacist advices. فالناس بنسميهم don't bug me. So once you have kind of those people in pharmacy, okay, maybe it's too hard to convince them to buy, like you feel like they really need vitamin C or they really need to do like electrolyte checkup or vitamin checkup, so you can help them to improve their what they're looking for. But it's too hard to convince them that they need really to go back to their doctor or healthcare provider and get these tests. We call them don't bug me. You have some kind of consumers in health or looking for health who are followers. They seek guidance from peer, from friends. You're gonna have consumers telling you, like my friend, like got this medication for their condition. I have similar conditions, and they want to get similar medication, and so they only follow. And it's always good to send a very useful and benefit messages for those people, because they only follow others, and following others, especially when it comes to health services, might not be always like a good idea. Okay, because even if you have two similar patients with a similar age group and similar diseases, they might need different medications. Okay, always remember inter-individual variability and different responses to medications, or remember just provision medicine or personalized medicine. And you have self-sufficient consumers who are like, they have high self-esteem, they have high efficacy, they're independent, they can take care of themselves. Okay, so after you do the segmentation, actually you're gonna deal with different segments, and you're gonna say like, okay, I gonna have those hypochondriac patients, and I need to have my pharmacist well trained about how to provide them with the services they really need. Health seeker, I might be able to help them with my pharmaceutical knowledge to give them the product that they really need, or the differentiated product that they might really need to make them happy. Okay, so as a recap, market segmentation is a very good idea in general. Okay, whether you're gonna target small segment or a smaller segment, what we call it niche. We do the segmentation to focus our services and products, to focus our messages for a small group of consumers. هذول الناس, they shared similar characteristics. Is it always good to have segmentations? It's always good, but there's some kind of drawbacks. The market is changing. You might not be able to access those people. Whether you're segmenting based on demographics or geographics or psychographic or behavioral, you are the one who's going to decide which of these variables you are going to target. You have a good database about demographics, you might divide your market على demographics تاعونك, but might be not the best idea because you only have demographics. You have nothing about their wants and demands. You need to know more about wants and demands of the consumers to better serve them. You might need to go to the behavioral segment or psychographic segment. Okay. حد عنده أي سؤال so far؟ حدا عند حدا سوري، حدا عنده أي سؤال؟ بدي إياكم تركزوا على هاي المصطلحات وتفهموا الموضوع as part of your own career. يعني لما نحكي mass marketing أو undifferentiated marketing بدي إياك تكون قادر إنه to define this concept. Okay, how you are targeting the whole market, how you are ignoring segments. Okay, the product focus على كل ال consumers. بس لما نحكي differentiated and I advise you to always use these concept in daily life. They're gonna provide differentiated services. They're gonna target the whole market. They're gonna go concentrated or niche. Okay, so استخدام هاي concepts throughout your career and your line of business would really help you to develop different skills in marketing and promotions and gonna get you like a guidance how to increase your share and how to know your competitors and how to get along with other lines of products. So إذا ما حدا عنده أي سؤال بتوقع يوم الأربعاء بنقدر نلتقي كمان مرة نعمل wrap up أو recap for the whole material. حدا بيعرف متى الفاينل تاعكم؟ تعرفوا متى الفاينل؟